What if treating Alzheimer's didn't require taking drugs indefinitely? Welcome to part 2 of our series on modern Alzheimer's treatment strategies. I'm Dr. G with Jerry Academy, and today I want to talk about Kisunla. The generic name is Donanemab, and I want to explain how it works because patients keep asking me that question. Well, Leqembi focuses heavily on neutralizing floating toxic protofibrils, that loose mulch we talked about in part 1. Kisunla operates under a totally different mechanism. The hypothesis is it targets the heavy mature plaque core sitting in the brain tissue, this big rock right here. So Kisunla targets a very specific type of protein called N3pG amyloid, and it's almost found exclusively inside established plaque deposits by binding directly to the core, and it signals the brain's immune cells to aggressively break it down and remove them from the brain. So because its main goal is clearing these hard, mature plaques in clinical trials, the unique approach shows that once an amyloid PET scan confirms the plaque is cleared down to minimal levels, then theoretically patients can actually stop treatment. In studies, nearly half of patients completed their course and stopped infusions with 12 months, and over 70% completed with 18 months of treatment. Now, as a clinician, here's the critical point. Is it better to target the heavy plaque core or the floating protofibrils? There are two distinct scientific schools of thought here. I use both drugs, but we shouldn't view one as necessarily better than the other. In fact, clinical data shows both strategies seem to slow down the disease progression by a very similar margin, roughly 35 to 40% in early stage populations. It's not about picking a winning drug. It's about understanding two different valid ways to intervene in the disease process and selecting patients appropriately. So drop your thoughts, ask any questions. Additionally, as I've discussed in other videos, I think treatment extends beyond amyloid. This is just another tool in the toolbox.